Hi guys, welcome to my channel. My name is Virginia. For the people who are new here, I give information about weight loss surgery. Personally, I'm having a gastric bypass on this year in May, and I want to share my experience with you guys, and I want to share my informations. I want to share everything that I heard, everything that I learned from the internet. So I want to share all with you guys. So I don't encourage to do the surgery. So this channel is not to encourage people to do the surgery. I'm just sharing my information and I'm just sharing with you guys my weight loss journey. So welcome. If you're interested, guys, join the family and subscribe this channel, please. So welcome. um, this vlog is going to be about the differences between the gastric bypass surgery and the vertical sleeve gastrectomy. I'm having the gastric bypass surgery. My surgeon gave me those two files, documents, I don't know how you say it or how you want to name it, but he gave me those two so I can read about the differences about the two of them. I read all this and there is not much. So the differences, there is not much actually. But yeah, let me explain it, of course. So I'm having the gastric bypass surgery. What you're going to do is, as you can see, what you're going to do. So this is my stomach. It's not my stomach, but you know, this is how a stomach looks like. So what they're going to do, guys, they're going to cut this part here and this part. So you can see they're going to cut this part here and this part, and they're going to attach both of them together. So this is my stomach. They will cut this part here and this part, so this part and this part, and they're going to attach this part and this part together. So this small piece is my new stomach and this is the old stomach, but the old stomach stay in your belly, so it stay inside. The sleeve is, this is your stomach, so they cut the half of your stomach, as you can see, they cut the half of your stomach. This part stays, this part is your new stomach, and this part goes away. So this part doesn't stay in your belly. So they cut the half of your stomach, this part stays, and this part goes away. So that's the sleeve. That's the differences between those two surgery, the gastric and the sleeve. So I heard from my doctor, from my surgeon, I am not sure, maybe I misunderstood. But I think with the gastric bypass, there is more complications than with the sleeve. And also with the gastric bypass, you lose your weight faster than with the sleeve. I'm not sure if you want to know more information about it, please talk with your doctor. I'm not a doctor, I'm just sharing my experiences. So what I think of what I heard, maybe I misunderstood, is with the gastric bypass, you lose the weight faster and there is more complication than with the sleeve gastrectomy. Okay, so what those two have in common is the cons and pros. I will explain that in another vlog, but those two surgery have the same cons and pros. You will lose the same amount of your weight. So with the gastric bypass, if I lose 40% with the gastric bypass, I will also lose 40% with the sleeve. So you lose the same amount, the same percentage with those surgeries. So the cons and pros are the same. You will lose the same amount, and the recovery process is also the same. I think for both of them is 6 week recovery. So the recovery process is the same. I think with the gastric bypass, you have to stay like 2 nights in the hospital, and with the sleeve, you have to stay 1 night at the hospital. Okay. The differences between those two is that, let me see. Personally, I think that the gastric bypass is more complicated than the sleeve one. So the gastric bypass is more complicated. With the gastric bypass, you will lose weight faster. That's what I think. I'm not sure about it. Also, with the gastric bypass, I think the gastric bypass is for the people who never had a bariatric surgery and who has acid reflux, like me. I have acid reflux and I never had a bariatric surgery, so that's why the doctor said that the gastric bypass is better for me. The sleeve, I think, is less complicated. I think you will lose weight slower than with the gastric bypass. And I think the sleeve, the vertical sleeve, is for the people who doesn't have acid reflux, and it's for the people who already had a bariatric surgery, and it's also for the people who has a BMI of a BMI above of 50. So you have to have a BMI of 50 or above. So let me repeat myself. So the gastric bypass and the sleeve have the same constant pros. You will lose the same amount of the same percentage of weight, and the recovery process is the same, is 6 weeks. The differences is that I think with the gastric bypass, you have to stay 2 nights at the hospital, and with the sleeve, you have to stay 1 night in the hospital. The gastric bypass, I think, I'm not sure, is more complicated than the sleeve one. The gastric bypass, with the gastric bypass, you will lose weight faster than with the sleeve one. And the gastric bypass is for the people that has acid reflux and that never had a bariatric surgery before. The sleeve, with the sleeve bypass, you have to stay 1 night at the hospital. You will lose weight slower than with the gastric bypass. The sleeve surgery is for the people that has a BMI above 50, 50 or above. That's for the people who doesn't have acid reflux, and it's for the people that already had bariatric surgery. It doesn't have to be a weight loss surgery, also another bariatric surgery. So if you already had another bariatric surgery, then I think the sleeve is better for you. So I hope, guys, I explained this well. I hope you guys understand me. So yeah, this information is the information that I got from the internet, as also information that I heard from my surgeons. Now, this information is here, is what I heard here in Belgium. It can be that in your country there is, I don't know, another system that is different. I don't know. I'm just saying what I heard here in Belgium and what my surgeon told me. So, if you want to talk about it, if you want to know more information, please talk with your doctor, because I'm not a doctor. I'm just sharing my experiences. I'm just sharing the information that I've got. So talk with your doctor first, please. If you are a person who already had a surgery or a bariatric surgery or a weight loss surgery, or you are a person who is going to have a bariatric surgery, please comment down below your story, your experiences, so I can also learn and I can talk with you guys about it. So yeah, I hope you have a lot of information. I hope my information is enough. I hope you understood my information. So yeah, this was the vlog for today. So thank you so much for watching. On my next vlog, I'm going to explain the cons and pros with of the surgery. I'm going to explain the cons and pros of the two surgery. So if you're interested in my content, if you're interested in this channel, please don't forget to subscribe and enjoy the family. And please comment down below your story. I really want to hear it. I really want to learn from it. So thank you so much for watching. I hope you guys enjoy my vlogs, and I see you guys on my next vlog. Bye.